There is an indexing update for hypoglycemia, and I suspect that this came about from the new hypoglycemia level codes that came up in October. The indexing was kind of messed up. So if you looked up decreased blood glucose, there was no code next to that. It automatically has the hypoglycemia levels listed under that, and it looks like you only assign a code for the hypoglycemia level, but you don't assign code E16.2. Likewise, and that was if you looked up decreased blood and then glucose. But if you looked up decrease and then glucose, it gave you code R73.09, which is not correct. So your decreased blood glucose and decreased glucose both are now going to map to E16.2 in the index. And then these new codes for hypoglycemia level, just a quick note, Coding Clinic fourth quarter of 2024 always talks about the new codes that came out in October, and they just kind of reiterate, you know, those codes are intended to be used as secondary diagnosis. They should not be first. So you need your E16.2 code first, followed by your code for the hypoglycemia level. And that Coding Clinic went on to tell you what those different levels mean, but just a reminder, we've got a coding guideline that says our code assignment is based on the provider's documentation that a condition exists, not on clinical criteria. Likewise, there is no guideline that says that if the provider documents hypoglycemia and a clinician tells you the level, that you can code the specific level. This really should be a query or something that clinical documentation improvement specialists work with the providers on to document the level when hypoglycemia is present.